This interview is brought to you by Commvault. Introducing Commvault Cloud Cleanroom Recovery, the ultimate solution for secure air-gapped data protection. Now you can test your cyber recovery plans as often as you like with no added costs or complexity. Our industry-leading solution isolates your data from external threats to provide the highest level of security. Experience the peace of mind that comes with comprehensive data protection. Choose Commvault Cloud Cleanroom Recovery for unmatched security and reliability.
Hi everyone, I'm Sarah Seibert, Managing Editor at GovCIO Media and Research. I'm tuning in from Las Vegas, Nevada. I'm here with Jeff Shilling, the CIO of NCI, and we are here for AWS reInvent. So I got to pull him aside for a few minutes to talk about, drumroll, AI to start, but we'll get into more of the meat of data, security, data sharing, data privacy throughout this interview. So to kick things off, I know I made a joke about AI, but it is more than a buzzword. It's what everyone's talking about. So as it becomes more relevant and accessible in our day-to-day lives, like we were talking about, there's this productivity versus disruptive types of AI. How do you see this enabling and changing the healthcare ecosystem as we move forward?
Well, I think everybody was really surprised when it came out 2 years ago, right? Because clearly these companies had been working on it. And then it kind of kept it under wraps until OpenAI revealed it, right? And so it was so amazingly powerful that really, I think, has shook everyone who has a lot of data. You know, in the intervening years, we've been utilizing it, trying it out, and really kind of trying to make plans for how we're going to use these things in the future. So we have plans related to working with the vendors who are producing these LLMs. We have a lot of work related to our whole oncology ontology. So all the unique words that we use in oncology or that are used in oncology, the LLMs don't really know them very well. So they're not heavily trained on them. So it would be hard for example, for the LLM to make a lot of sense of the literature if it really didn't know the differences between these technical terms. So I think there will be a lot of working with the vendors and training models to help the model better understand what all these medical terms are.
Right. Yeah, that totally makes sense. And as you're training, and not only is healthcare, it has a lot of technical language, but also just data in general. There's not a lot of standardization. It's in different formats. Getting it all on the same page to then get it into AI can be difficult. So what are some of the ways you're working with data to standardize it so that it works for future tech initiatives?
In the cancer world, we had our director, Monica Bertagnoli. She was then promoted to become the NIH director. And she really, before she became the NCI director, started working on this standardization called M-Code. And it's really just a very basic standard for clinical data. So what day were you treated? You know, what's your actual disease, and what were you treated with? How much of it? Very, very basic stuff. Not really considered a medical record, and so that's really a very crude way to try to create a parallel record, rather than what we'd like to do is kind of digitize the medical record. So we're hoping that AI can really help with that. Really start to go from this prose model where the doctor is either dictating or writing down, and the nurse, all the clinical staff are writing down what they did and what was your reaction, how you're progressing with your treatment, and all those different things, to using AI right there, right, listening to the interaction and capturing that information right away, and then the doctor looking at that more structured data and saying, or the nurse or the nurse practitioner, and saying all that is correct,
right,
or fixing it. Right now, trying to take anything that's prose written by a doctor or written by the clinical staff and then put into structured data is just a guess. It might be a very good guess, but it's still a guess. So the idea, I think, would be we're going to have a transition the way we used to do data, which is for treatment and for billing purposes. We're now going to have to add another layer, something that we can do for machine learning.
In this theory, there's AI in the room listening, taking notes. The doctor then gets to sign off on it. So that introduces some new privacy questions, I'll call it. I won't call it challenges, but like questions about privacy. So as you're introducing these new technologies, what are some of the ways you're looking at either the ethical concerns or the privacy concerns around that data, and who has access to it or what has access to it?
Right. Well, that's a great question. And that's really kind of beyond our scope in a way. But what we were doing is we have staff, our deputy director for data science is working and collaborating with the ONC. So really, they're in charge of the rules. They're the ones who say, in order to get paid, you have to do this. So they work kind of closely with CMS.
Right.
So it's really around them creating these new rules and this new infrastructure and trying to get the data standards in a way that the data can be reused. So one very simple example would be each hospital creates its own medical record system, right? And even though there's only one or two providers of that software, it can all be configured in a unique way, depending on how that hospital or that care facility treats you. And what that means is that the nurse's notes might be stored in one place and another place and another. And so how you extract that information is different.
Yeah.
So that means more money. So the idea is to slowly start to get the electronic medical record companies to not just be around patient care and billing, but about the digital shareable kind of information. And then on top of that, lay the ethics and the privacy. And what if a patient or the patient's family says, I don't want to share this anymore? How do we pull that out of the study or something like that? How is that out of the model, right? We know AI models can't pull data out of there, right? So we're going to, I think, slowly have to learn as we go.
What are some of the training or workforce initiatives that you're focused on as we deal with this future tech landscape?
So I would say, we were talking earlier, and we really break it down into two types of features. The kind of features where you use AI, well, it's like personal productivity, and those will not be very disruptive. And probably staff will be able to take very standard training, the product they're using. They could be using Excel, or they could be using something, how to write R, right? And there will be classes for that, and how to use an AI system to help you do that. And so I think we have some things going forward that really aren't aligned with standard traditional training. But I think the part where it's going to be more complicated is when we use this in a more disruptive way. So it is disruptive to our organizational structure, or it's disruptive to how people function. And so we don't need 5 people to do that anymore, we need 1. Or we don't need 5 people, we need 10.
Right.
Right? Because we're doing something very differently. How do we create measurements for success, make sure people are trained to say, okay, this is working well, it's not working well? And I don't think that training is really out there yet. Right? The LLMs and this technology outside imaging, in imaging, it's very mature. You have a lot of people who have been doing that for well over a decade. But with language, it's not mature. You can't just go take a course, or you can't get certified by a university, or we don't even know what that means. You can get certified by OpenAI, I think. But when I've talked to the people who've had it, they're like, yeah, it was just something I did.
Right.
It's really not thought of as something that's going to be useful yet. I do think there's a lot of concern. And all the sensitive information, we only utilize it in often what they call zero retention models. So it won't remember anything. But then it doesn't remember anything. So it's not that useful.
Right.
So we're going to have to kind of figure out a way to say, okay, it knows who you are. Like, imagine if you could just talk to the LLM and say, I'm not really feeling well today.
Yeah.
And this is what I'm feeling. And it would say, well, I know your blood pressure's high and your temperature's high. I'm going to make an appointment with you for the doctor. And I sent them your information. Those kind of things are going to be very available. And people will then start to see, the more I monitor myself, the better my kind of care will be, even if it's just self-care. So we know in cancer, so we're studying cancer. So it's all about, of course, very sophisticated treatments, but ideally it's about prevention. And so it's not, and of course prevention is not very, you prevented it from happening. So it seems like, I just got lucky. Or maybe it wouldn't have happened to me anyway. But I think there's no measurement for prevention. Like, hey, you never smoked, or you never did this, or that means you should have this good score. But I think people will be doing that. We certainly know the insurance companies are giving you money for your preventative care. They do, like, we'll give you $50 if you get this preventative test, right? You either get a breast exam, prostate exam, your colonoscopy. You kind of getting rewarded because the prevention to them saves so much money. So I think there's something there, but how we weave in all this information that we're getting from the world around us, right? The step counts on your watch and everything will be kind of tied into that. So,
are there liability issues when you're integrating this technology in healthcare? Like, if AI tells you, okay, your baby needs Tylenol and to be in a cold bath, and then something happens, who's responsible for that?
Well, this is what I would say, is that in our world, we used to have no regulation over medicine. That might not be something that you're aware of. There used to be a time in the United States where there was no FDA. And people would go around and sell medicines to people. And then there was an event and a lot of people died because of this bad chemical that was in this medicine they sold these people. And through that, the FDA was created. Every time the doctor sees you, everything they talk about is FDA approved. So you really only need to see, for this thing, this is what you do, right? It's FDA approved. It's all documented. If you have a certain kind of cancer, the doctor doesn't say, let's see, what should I do? There's NCTN guidelines. There's guidelines for stage 3A, this type of cancer. These are the two options for treatments. Yeah. And this is what's been studied and what's known to work. I think one of the things you could start to do is start certifying data. Like, let's say for 2024, the NCI, the National Cancer Institute, and the American Cancer Society certified that this is information that's relevant to cancer. So if your doctor talks to you about this diagnosis, you can read this and understand what that means. Officially, it's official. And we don't have that today. We don't have like a certified stamp, and I think we're going to need to do those kinds of things.
Right. I totally agree. That makes a lot of sense.
And version control it. So, because maybe in 2030, that data will no longer be accurate, right? We now know something's different.
What are some of the conversations you've seen or heard or tools you've seen that really excite you as we look forward to the future tech landscape?
Well, I think the first thing is the amount of people that are here is crazy. Right? Like, it must be 30,000 or 50,000, right? It's a lot of people. Technologically, I think the one thing I did see today, a graph which showed how much, for me as a federal person, how many of the systems in AWS are FedRAMP certified now. And you see it like really growing, doubling every year from 60 to maybe 2 years ago, or doubling every 2 years to now over 120, and I think in 140 in 2024. So that's really good because that makes our utilization of that technology very quick. So, I do like to say, we are really in the golden age now of the cloud. Everything is great. Everything is affordable somewhat. There's competition. And I hope it lasts for a long time.
Yeah, that's so true. I was at a conference, it was a couple years ago before generative AI was even a thing, but there was another federal CIO that said, AI is going to be more revolutionary than fire. And that scared me, but it's also exciting. So
yeah.
I appreciate you joining to chat about it.
It was so nice to talk with you.
Thank you.